All right, today we're going to tackle a topic that, really touches millions of lives: breast cancer. We're going to walk through everything, step by step, to build a really clear picture of what it is, how doctors figure it out, and the modern ways we're fighting it.
Okay, let's just dive right in with a fact that might actually surprise you. When we talk about breast cancer, we almost automatically think of women, right? But about 1% of all cases happen in men. It's just a powerful reminder that while it's way rarer, this disease doesn't care about gender. So to make sense of this pretty complex topic, we've broken it down into 5 key parts. We'll start with the basics of what breast cancer actually is, then we'll look at risk factors, get into the diagnosis process, classify the different kinds of cancer, and then finally wrap up with how it's treated today.
So let's start at square one. What is really going on at a cellular level when someone develops breast cancer? At its absolute core, breast cancer is just the uncontrolled growth of cells in the breast. It typically kicks off in the tiny cells that line the milk ducts, or the lobules. Those are the glands that make milk. You can almost think of it like a switch for cell growth getting jammed in the on position, leading to this mass of cells that just shouldn't be there. Now, what's really fascinating is that this doesn't happen overnight. It's a gradual process, almost like a slow-motion chain reaction. It starts with perfectly normal cells, then some of them start to multiply a little too fast. Over time, these cells can start to look abnormal. Then you might get what's called an in situ cancer, meaning it's still contained. The real turning point, the critical moment, is when those cells break out of that container and invade the tissue around them. That's when it becomes invasive.
Okay, so now we get what it is. The next logical question is, why does it happen? Let's take a look at the factors that can increase a person's risk. Both the things we can control and, well, the things we can't. Risk factors really fall into 2 main buckets. In one bucket, you've got the stuff you can't change, like your age or your genetics. For example, having certain gene mutations, like in the famous BRCA1 and 2 genes, can really raise your risk. Even things like when you started your period or went through menopause matter, because it's all about your lifetime exposure to hormones. Then, in the other bucket, you've got lifestyle factors we have a bit more control over, like drinking alcohol or maintaining a healthy weight, especially after menopause. So, what happens when someone finds a lump, or maybe something shows up on a routine screening? How do doctors get to the bottom of it? This brings us to the absolutely crucial process of diagnosis. You see, diagnosing breast cancer isn't just one single test. It's a super systematic approach that pulls together a few key steps to get a really clear and incredibly accurate picture.
The absolute gold standard here is something called the triple assessment. It's this powerful 3-step process. First, it starts with a physical exam by a doctor. Then, that's followed by imaging, think mammograms or ultrasounds, to literally see inside the breast. And the final, definitive step is the biopsy, where a tiny sample of tissue is taken and looked at under a microscope. Each step is a piece of the puzzle, and when you put them all together, you get a really, really reliable answer.
And this is so important to remember. The vast majority of breast lumps are not cancer. There are tons of common, totally benign things, like little fluid-filled cysts or harmless growths called fibroadenomas. And that's exactly why the triple assessment is so essential. It lets doctors confidently tell the difference, which, as you can imagine, can provide enormous peace of mind. Okay, so if the diagnosis does come back as breast cancer, the next vital step is to understand the specific personality of that particular cancer. This classification is everything because it tells doctors exactly what they're dealing with and how to fight it most effectively.
Yeah, not all breast cancers are created equal. The most common type, by a long shot, we're talking about 80% of cases, is called invasive ductal carcinoma. If you think of the milk ducts as tiny pipelines, this is where that cancer starts before it spreads. Then another 10% or so is invasive lobular carcinoma, which starts in the milk-producing glands themselves. Just knowing where the cancer began is the first clue for treatment.
Now, this right here is one of the single biggest breakthroughs in modern cancer care: figuring out the receptor status. On the surface of cancer cells, there can be these little proteins that act like locks. Pathologists look for 3 main ones: 2 that are triggered by the hormones estrogen and progesterone, and a third one called HER2. These receptors can basically act like fuel lines, telling the cancer cell to grow, grow, grow. And here's why those locks are so incredibly important. They tell us which keys will work to stop the cancer. If a cancer cell has hormone receptors, we can use therapies that block those hormones from fueling the fire. If it has HER2 receptors, we can use amazing targeted drugs that shut down that specific signal.
And if it's triple negative, meaning it doesn't have any of these three targets, then doctors know to turn to chemotherapy, which takes a more broad spectrum approach.
Finally, to figure out how advanced the cancer is, doctors everywhere use a system called TNM. T is for the size of the tumor. N tells us it's reached the nearby lymph nodes, which are kind of like the body's drainage system. And M stands for metastasis, which answers the huge question of whether the cancer has spread to distant parts of the body. This system gives us that clear picture, from an early stage 0 all the way to an advanced stage 4.
So, with all of this amazing information, the type, the receptors, the stage, doctors can finally put together a truly personalized battle plan. So, let's look at the main ways breast cancer is treated.
For most early-stage breast cancers, surgery is the first line of attack. The choice between a lumpectomy, which just takes out the tumor, and a mastectomy, which removes the whole breast, really depends on things like the tumor's size and location, and, of course, what the patient wants. And during the surgery, doctors will often check the very first sentinel lymph nodes to see if the cancer has started to travel.
But surgery is very often just the start. It's usually followed by other treatments to hunt down any cancer cells that might have been left behind. Radiation therapy can zap any remaining cells right there in the breast area, while systemic therapies, the ones that travel through your whole body, are chosen based on that receptor status we just talked about. This is where chemo, hormonal therapy, and targeted therapy all come back into the picture.
So, when you pull it all together, what really determines a patient's outlook or their prognosis? Well, a few things are key. Maybe the most important factor is whether the cancer has gotten into the lymph nodes, because that's often its first stop on the way to the rest of the body. After that, whether there's metastasis, the tumor's size, and its unique receptor status are all critical pieces of the puzzle.
You know, we have come such a long way in fighting breast cancer. Detection is getting earlier, and treatments are getting so much smarter and more personalized. The outlook is truly brighter than ever. But the work is not done. The next great frontier may not just be about treating cancer better, but about understanding its triggers so precisely that maybe, just maybe, one day we can stop it from ever getting started. Thanks so much for joining me for this Explain.